Every heart rate, blood pressure reading, and hospital stay recorded in clinical research is a single drop in an ocean of data. To make sense of thousands of patient records, researchers have to distill all those individual ages, test scores, and lengths of stay into a single representative value. This distillation relies on a concept called central tendency. Central tendency is the statistical process of identifying exactly where a specific set of clinical data naturally clusters. But there is a catch. There is no single, universal mathematical definition for the word average. The true geometric center of any dataset depends entirely on its level of measurement and the physical shape of its distribution. To find that center, researchers rely on three distinct statistical metrics: the mode, the median, and the mean. A mathematical error in these calculations directly misrepresents patient populations and compromises the clinical, evidence-based practices that rely on that data. The mode is the simplest of the three metrics. It represents the specific numerical value or category that occurs with the absolute greatest frequency in a dataset. This chart shows nominal level data, unranked categories like blood type. Here, the mode is the only mathematically acceptable measure. Its advantage? Total immunity to extreme numerical outliers. However, it is highly unstable. Datasets can frequently be bimodal, which severely limits advanced algebraic treatment. When data can be ordered, we move to the median. The median is the exact geometric center of a rank-ordered dataset. To locate it, we organize the clinical values from lowest to highest, easily locating the exact middle integer. As a dataset has an even number of observations, you instead locate the two central values and average them to find the true center. The median represents the exact 50th percentile. It splits the patient population perfectly in half, regardless of extreme values. This makes the median the most precise measure for ordinal data. Because it only looks at position, it remains highly resistant to extreme clinical outliers. But this positional focus is a trade-off. By ignoring the quantitative weight of surrounding data points, the median has limited utility in complex statistical formulas. While the mode and median provide rigid, outlier-proof anchors, their isolation from the exact values of the full dataset prevents deeper statistical analysis. This brings us to the mean, the arithmetic balance point. It's calculated by summing all scores and dividing by total observations. While it is the gold standard for continuous data, the mean is highly sensitive to extreme outliers, which quickly pull the balance point off-center. We can see how this behaves by looking at a completely normal distribution, a dataset completely free of severe outliers. This graph shows an idealized clinical environment, forming a pristine shape. In this flawless distribution, the mean, the median, and the mode are mathematically equal. They sit precisely on top of one another at the peak, aligned by a bold vertical line. The mean is a highly powerful tool when the data is perfectly symmetrical. However, real-world clinical data is rarely perfect, setting a trap for unwary researchers. When severe clinical outliers are introduced to a normal distribution, they create a phenomenon known as skewness. Skewness is a measure of the asymmetry of a distribution around its statistical center. This graph shows a positive skew, mapped here using data on the length of patient enrollment in a hospice program. In hospice care, most patients pass away within a few days or weeks of enrollment. That massive cluster of short stays establishes the mode, anchoring the high peak on the left side of the curve. However, the rare outliers, patients who survive for months or even years, act as heavy mathematical weights. They violently drag the arithmetic mean away from the peak and toward the extended right tail. This creates a strict mathematical hierarchy inside a positive skew. The mean is greater than the median, which is greater than the mode. Now look at this chart showing the onset of chronic illness by age. This illustrates a negative skew. The vast majority of chronic illnesses occur in older populations. This establishes the mode right at the high peak on the right side of the distribution. But rare early onset cases in youth generate low-value outliers. Those few young patients pull the mean backward, dragging it down the x-axis. Inside a negative skew, the hierarchy is reversed. The mean is always less than the median, which is less than the mode. In highly asymmetrical clinical datasets, Reporting the arithmetic mean gives you a number that is technically mathematically correct, but if that number is pulled by outliers away from where most patients actually cluster, it becomes entirely clinically misleading. This table maps the 3 measures of central tendency against their ideal data levels and outlier sensitivity. Accurate nursing research requires explicitly matching the correct statistical tool to the geometric shape of the data. For nominal, unranked categories, researchers must use the mode. For interval or ratio data forming a perfect symmetrical curve, researchers should deploy the mean to achieve maximum mathematical rigor. And for distributions corrupted by severe clinical outliers or severe skewness, researchers must default to the median. The equations are only useful if they accurately reflect the humans they measure. A mathematically flawless calculation applied to the wrong data shape produces a false reality. Mastering central tendency is a vital diagnostic skill, one strictly necessary to protect the integrity of patient data and, by extension, the patients themselves.